Hello, I am Dr. Jocelyn, a urologist, and today I wish to speak with you as clearly and closely as possible about a subject that many men over 60 endure in silence. A subject that at times brings shame, fear, and is seldom discussed even with the most intimate partner. Today, I would like to pose a straightforward question to you. How would it feel if you experience climax with the full intensity of orgasm, yet no drop of semen appeared? Perhaps this has occurred to you once and left you reflective, puzzled, even frightened. Maybe it happens regularly and you have chosen to remain silent, keeping it as a secret you hesitate to reveal. Whatever your situation might be, I want you to know something essential. I understand you profoundly. In my practice, I have encountered men who arrive with anxious eyes, unsure how to describe it. Some hardly murmur it, as though admitting a humiliating secret that makes them feel less masculine. Others share that they have even shunned intimacy out of fear that their partner might notice, dreading the question that could follow, or simply because they sense something vital has failed within them. I have listened to patients say, "Doctor, I don't feel whole anymore. It seems my body has let me down." Or, "I'm worried my wife believes I no longer want her." That emotional weight is as genuine and burdensome as the physical alterations themselves. And that is precisely why today I invite you to remove the shroud from this taboo. Because what occurs in intimacy is far from trivial. It is not a minor detail. It forms part of your general health, your self-assurance, your emotional wellness, and your overall quality of life. And here is an important reassurance. It does not signify that you have lost your virility or that your masculinity is threatened. What you are going through is a signal from your body, a message that requires comprehension and, in most instances, can be addressed. But remain with me, as in the coming minutes we will delve together into the causes, the red flags, and especially the solutions that modern science provides. Understanding normal ejaculation. Before grasping what occurs when semen fails to emerge, it is helpful to recall how typical ejaculation functions. Picture within your body a small orchestra in perfect harmony. Every instrument has a vital role, and all must play simultaneously for the melody to be whole. In usual circumstances, the testicles generate sperm. The seminal vesicles supply the majority of the fluid, rich in nutrients and energy. The prostate, in turn, contributes a unique fluid that safeguards and aids in transporting the sperm. All of this converges in the urethra, like musicians awaiting their cue backstage. When peak arousal arrives, the muscles of the reproductive system activate. They contract in rhythm and with force, propelling the semen outward. It is a swift, nearly instinctive process, yet the outcome of precise coordination between nerves and muscles. Here emerges a crucial point. Orgasm and ejaculation, though they typically happen together, are not precisely identical. Orgasm represents the neurological response of pleasure and relief. Ejaculation is the physical expulsion of semen. Most men perceive them as one unified event, but actually they are two separate mechanisms that coincide. When both occur, the experience feels complete. Pleasure, relaxation, and the visible proof of semen. And that is exactly the core of what we will examine today. What occurs when that fluid is absent despite the sensation being there? What is dry ejaculation? The condition known as dry ejaculation involves the man achieving climax, experiencing the typical pleasure of orgasm, but observing no semen emerging or only a minimal, almost token amount. On the surface, it appears the body has finished the full process since the pleasure's intensity persists. Yet something is absent that has long been viewed as inseparable: seminal fluid. And that lack, however minor it may appear, can trigger a flood of emotions. This distinction, though it might seem slight in medical language, is what creates the deepest confusion on a personal level. Many men confide in me during consultations. Doctor, I felt exactly as before, but it was like the orgasm was hollow. That sense of hollowness is what drives worry and, in certain cases, profound shame about broaching the subject. I have had patients admit they checked multiple times, suspecting they might have missed it. Others who looked online and became filled with anxiety from encountering vague or frightening details. And still others who simply resolved not to attempt again, believing their sexual life was over. It is vital to recognize that orgasm is a neurological event controlled by the brain and nerves transmitting the pleasure signal. Ejaculation, conversely, is a mechanical, muscular, and glandular action. The ducts contract, valves open, and semen is ejected. They usually synchronize with exact precision, but they are distinct. When the former occurs without the latter, that bewildering confusion emerges. Is my virility declining? Have I forfeited my masculinity? Am I not the man I once was? And here I wish to be completely unequivocal. The answer is no, definitely not. Dry ejaculation does not indicate that desire or the capacity for pleasure has vanished. It merely signifies that the body has altered one aspect of its routine operation. But your essence as a man, your ability to feel, connect, and enjoy stays unchanged. This condition has multiple origins, some transient and others lasting. It could link to medical procedures, medications, hormonal shifts, or even illnesses impacting the nervous system or prostate. The key is to realize that each case has an underlying reason and often a remedy as well. Main causes. Cause 1, retrograde ejaculation. Of all the reasons explaining dry ejaculation, one of the most frequent is retrograde ejaculation. And I have to note that it is also among the most perplexing when I describe it initially. To comprehend it, envision a gate that ought to shut tightly at the bladder's neck during orgasm. When functioning properly, that gate seals the route to the bladder and routes the semen outward. But if that gate stays open, the semen follows the simpler route. It flows backward into the bladder rather than exiting via the penis. The outcome is straightforward to explain. The man senses the orgasm in full force. Muscular contractions happen. Pleasure exists, but no semen is visible. It's as though the entire system operates except for the final routing of the fluid. Often you detect it when your urine appears cloudier following intercourse as seminal fluid has blended in. Some patients have shared with me, "Doctor, I believed something was amiss with my kidneys, or that I had a serious urinary infection." The origins vary. One of the most typical is prostate or bladder surgeries such as transurethral resection or laser treatments. These interventions save lives, ease troublesome symptoms, and greatly enhance urinary comfort. But occasionally, as an unavoidable consequence, they disrupt the synchronization of nerves and muscles at the bladder neck. Additionally, specific medications for high blood pressure, certain antidepressants, and treatments for benign prostatic hyperplasia unintentionally relax that region, permitting semen to reverse direction. This side effect is frequently not highlighted at the start of therapy, and when it arises, it surprises the patient. Neurological impairment also contributes significantly. Uncontrolled diabetes, which slowly harms peripheral nerves, multiple sclerosis affecting the central nervous system, or spinal injuries from accidents or trauma, disrupt the commands that should seal the bladder gate. I vividly recall Jorge's case, a 58-year-old patient who, following laser prostate surgery for severe blockage, visited my office upset. He told me, "Doctor, my orgasms feel empty. I experience everything as usual, but I see nothing. Have I lost my manhood?" When I clarified it was retrograde ejaculation, irreversible in his situation due to the surgery type, but that it didn't impact his potency or desire, he sighed with relief. I demonstrated the post ejaculation urine test where sperm was evidently present. Then he grasped that his virility was still whole, that his body continued working, only the semen's path had shifted. Diagnosis is fairly straightforward. A urine test done immediately after a climax suffices to identify sperm in the sample. Regarding fertility, retrograde ejaculation indeed hinders natural conception. Yet assisted reproduction methods exist to retrieve sperm from urine or straight from the testicles. And for men not pursuing parenthood, intimate life stays enjoyable and fulfilling. The message is evident. Retrograde ejaculation does not equate to losing masculinity. It is a physiological shift deserving diagnosis, comprehension, and sometimes treatment adjustments. Cause 2. Obstruction of seminal vesicles. Another significant cause of dry ejaculation, less familiar than retrograde but just as important, is obstruction of the seminal vesicles. These glands, situated right behind the bladder, generate 60 to 70% of semen's total volume. Their secretion includes fructose and other nutrients that sustain sperm and supply energy for their reproductive role. When the seminal vesicles become partially or fully blocked, semen volume drops sharply or vanishes entirely. Though orgasm persists, it's like the main route for the fluid is shut. Pleasure remains, but semen's pathway is blocked. The reasons for this blockage differ. One common is past infections like prostatitis or urinary tract. Infections inadequately treated, leaving scar tissue inside. Another regular cause is seminal calculi, tiny stones akin to kidney stones obstructing ejaculatory ducts. Congenital cysts in the vesicle area or vas deferens can also stay dormant for years and appear in adulthood. Moreover, pelvic injuries or prior surgeries may constrict semen's passage. Symptoms aid diagnosis. Some men perceive orgasm as unfinished or feel deep pelvic ache or ongoing groin discomfort. Others observe semen looking thicker, diminished in amount, or with tiny clots. At times, the sole indicator is unexplained infertility, a frequent consultation motive. I recall Fernando, a 34-year-old patient, arriving with his wife after 3 years of failed conception attempts. He had normal erections and strong libido, but noted his semen growing scarcer. A transrectal ultrasound uncovered a cyst in one seminal vesicle. Through endoscopic surgery, we removed it, and months later, his wife conceived. Diagnosis demands specific exams. Transrectal ultrasound to assess vesicle shape and size, a semen analysis revealing low volume or missing fructose, and, in complicated cases, pelvic MRI. Treatments depend on the origin. Antibiotics and anti-inflammatories for infections, endoscopic procedures to clear stones or unblock ducts, or ultrasound-guided drainage for large cysts. Recovery is generally swift with excellent outcomes. In summary, seminal vesicle obstruction is a quiet yet manageable cause of dry ejaculation. Detecting it promptly enables restoration of sexual function and fertility. Cause 3. Hormonal factors. The third primary cause of dry ejaculation ties to hormonal equilibrium, particularly testosterone levels. This hormone, mostly produced in the testicles, drives sperm creation and the operation of prostate and seminal vesicles. It also boosts sexual desire, heightens sensitivity in intimate moments, and aids muscular contractions for ejaculation. When testosterone falls markedly, the mechanism starts to falter. At first, a man might observe reduced semen volume or it turning clearer and thinner. Gradually, additional symptoms emerge: lowered libido, weaker erections, diminished intensity, and possibly dry orgasms. Often, ongoing fatigue, muscle loss, and mood shifts accompany this. It is crucial to note that aging alone should not mean complete vitality loss. In many instances, it involves hypogonadism, a hormonal shortfall needing medical care. This may be primary if testicles underperform, or secondary if the issue is in the brain's pituitary or hypothalamus, failing proper signals. Diagnosis relies on thorough hormonal testing covering total and free testosterone, LH, FSH, prolactin, and thyroid hormones. Low testosterone, especially with symptoms, signals a treatable issue. Treatment varies by cause. Testosterone replacement via injections, gels, or patches can enhance energy, desire, and semen output. However, it isn't ideal for those wanting children, as it might impair fertility. Alternatives then stimulate natural testosterone and sperm production. In the end, hormonal drop is not just aging's trivial aspect, but a cue to address. Rebalancing can restore energy, passion, and rewarding sexual life. 4. Warning signs and associated serious illnesses. Thus far, we have explored causes that, while worrisome, frequently have remedies. Yet, dry ejaculation can signal something graver, a symptom not to ignore when paired with other indicators. First, consider urological cancers. Prostate cancer, as it expands, may block ejaculatory ducts, leading to semenless orgasms or with blood. In later stages, it brings ejaculation pain and worsening urinary issues. Bladder cancer disrupts semen release if invading the bladder neck or urethra, often with blood and urine. Testicular tumors might present as infertility and lacking seminal fluid. Another group is neurological disorders. Unmanaged diabetes most commonly damages reproductive nerves. Multiple sclerosis, Parkinson's, spinal injuries, or strokes also block brain to genital signals, resulting in dry or partial orgasms. Furthermore, rarer but significant autoimmune and systemic conditions exist. Lupus may inflame vessels feeding prostate and vesicles. Scleroderma stiffens tissues, obstructing ducts, and sarcoidosis forms, granulomas disrupting seminal flow. When to consult a urologist urgently? If dry ejaculation starts abruptly, with pain, blood in urine or semen, genital numbness, leg weakness, or ongoing fever. These are alerts for serious issues demanding prompt action. In closing, while dry ejaculation is usually benign, certain cases make it a vital alert. Heeding your body and seeking timely advice can alter outcomes, not just intimately, but for total health. Number 5, emotional consequences and quality of life. Apart from physical elements, dry ejaculation deeply affects older men's emotional world and self-worth. I want to linger here because, from my practice, emotional harm can devastate as much as any bodily sign. Many sense lost masculinity or diminished sexual ability, sparking anxiety, irritation, and sometimes total intimacy avoidance. Stories abound of men withdrawing from partners, evading closeness, fearing judgment, or feeling incomplete. Some cease starting encounters. Others offer excuses: fatigue, work pressure, small ailments. Yet beneath lies dread of partners spotting perceived failure. The emotional load matches physical symptoms in weight. I have witnessed men tear up in my office discussing this, heard tales of couples growing distant because the man couldn't explain. Shame and guilt fuel a harmful cycle, harming trust, esteem, and life quality beyond sex. One patient shared, "Doctor, my wife believes I don't desire her anymore, but that's untrue. I want her as much as ever, but I'm terrified she'll notice my body doesn't respond like before." It took him months to seek help and more to confide in her. When he did, she revealed thinking of infidelity or lost attraction. The long-delayed talk became emotional recovery's start. Still, recognize not all is gone. No semen doesn't erase desire, pleasure, or intimate enjoyment. Many retain normal erections, strong orgasms, satisfying sex lives. Orgasm stays pleasurable, connections can deepen, intimacy as fulfilling. First, view this as physiological shift, not personal defeat or aging's penalty. Not moral judgment or virility loss, just bodily adaptation like others over years. Knowing the cause and getting help restores calm, confidence, partner bonds. Crucially, include your partner. It's vital. Honest, open, vulnerable dialogue turns isolation into deeper closeness. Many couples report stronger bonds after breaching fear and shame, discussing once forbidden topics. Openly accepting and tackling it enhances sexual health, esteem, confidence, life quality. Remember, seeking help shows strength, intelligence, and self respect, plus respect for your shared life. Number 6, practical tips from Dr. Jocelyn. Dealing with dry ejaculation can prove difficult, but practical approaches help handle it and preserve intimacy confidence. First, never dismiss abrupt bodily shifts. Sudden dry ejaculation or linked symptoms like pain, blood, or reduced desire demand quick urologist visit. Your body signals. Timely response distinguishes minor from major. Second, controlling chronic conditions like diabetes and hypertension is critical, directly affecting sexual function and ejaculation's nerve muscle sync. Maintain optimal blood sugar, adhere to meds, keep checkups. Third, healthy lifestyle prevents issues. Daily 30-minute exercise bolsters heart and circulation. Balanced eating supplies hormonal nutrients. 7 to 8 hours sleep regulates systems. Fourth, silence breaking is vital. Discussing with partner and expert clears doubts, eases anxiety, betters closeness. Seeing dry ejaculation as physiological, not failure, restores calm. Rehearse talk if needed, but communicate. Fifth, seek sexual or couples therapy if emotions overwhelm. No shame in professional aid. Therapists assist processing feelings, enhancing partner dialogue. Finally, heed medical guidance, regular visits for adjustments, function improvement, or fertility techniques when required. Solutions exist for nearly all dry ejaculation causes, but only with your initiative. Early diagnosis, healthy routines, open talk, medical monitoring form the top approach for rewarding intimacy. Your sexual health merits care and regard. Number conclusion. To sum up, dry ejaculation is neither masculinity's doom nor sexual life's termination. It is merely a bodily signal warranting attention, insight, and often successful treatment. Grasping causes, surgical, hormonal, obstructive, neurological, starts reclaiming serenity and assurance. Knowledge banishes fear. Proper care revives wellness. I have witnessed men, post-clear diagnosis and guidance, restore confidence, enjoy intimacy sans fear or shame. Cases like Jorge, Fernando, or Cayetano illustrate that, though adjustments or procedures may be needed, vitality and pleasure endure. Sexual life persists beyond 60, 70, or later. Heating body, regular exams, healthy habits, exercise, nutrition, sleep, chronic management bolster not just sexual function, but total health and esteem. Don't allow silence or surrender to dictate intimacy. Voicing, informing yourself, acting promptly can utterly change it, reviving confidence, wellness, partner connection. Dry ejaculation is change, not finale, and chance to know your body better, fortify bonds, prove true masculinity in courageously meeting challenges and sustaining loving intimacy. If this information proved useful, share experiences with men facing similar. And recall, specialist consultation always unlocks solutions and hope. Your masculinity isn't defined by one function. Your intimate life can stay rich and gratifying despite dry ejaculation. I wish you health, assurance, and satisfaction. You are never alone here.